And the early childhood development sector is seeking funds from government as preparations are underway to facilitate a secure learning environment for the children. The Centre for Early Childhood Development has also been looking at ways to do so as ECD centres for parents, caregivers and their children. So let's chat a bit more about this now. The Director for the Centre for Early Childhood Development, Professor Eric Atmore, joins me now. Thank you very much indeed for your time, Eric. Talk to us a bit about the impact that COVID-19 has had on early childhood development centres.
Evening, Griselda, and evening to your viewers. The impact of COVID-19 on the early childhood sector has been devastating, and it's been devastating at a number of levels. First of all, children have for 5 months not had the opportunity for a learning program. Now we understand under level 5 and level 4, that was fine. But even at level 3, the department refused to open ECD centres. And it took a Gauteng High Court ruling to force the minister to do that. So these young children, they didn't get their learning program. They did not receive the nutritious meal that they get at the Early Childhood Development Centre. And they were left in communities which are dangerous. And we've now seen around the country, more than 7 young children have been murdered or killed in this period, as young as a 2-year-old in the Western Cape. The other side of the devastation is that 180,000 of our ECD workers, predominantly women, have been without a salary for 5 months. And each of these women cares for maybe 4 or 5 people in their family. That's almost 1 million adults who've been affected by no income. And in all this time, there has not been 1 cent of support from the National Department of Social Development.
And I want to talk a bit about that, Prof. I understand that you're also working with approximately 600 ECD centres, most of which have, as you've indicated, already been under tremendous financial strain from the lockdown to receiving months of minimal fees from parents. Are they coping at this point with getting the prescribed personal protective equipment to comply with health regulations in the run-up to reopening?
No, they're not. In the Western Cape is the only province that is doing this. Minister Tito Mboweni announced 64.5 million rand, which he took from the ECD infrastructure budget, and he transferred it to PPE. The Western Cape is the only province that has acted on this, and PPE is now going out to early childhood development centres in the Western Cape. The bigger issue is that the Minister of Social Development managed to get 1.3 billion rand from the President's economic stimulus package. And she wants to use this money to employ 36 compliance officers. In other words, young people to police the compliance of these ECD centres. And we are saying that in the middle of a disaster, when you have 180,000 women during Women's Month not getting a salary, surely that money is better spent to supplement the already small salaries that these ECD workers get and to enable them to open the 32,000 ECD centres around the country. Her proposal of compliance and monitoring and bullying and policing at this time is wholly irrational.
Prof, I want to talk about, there's also a prospect here of some of these ECD centres being forced to close due to financial constraints. Is that the reality in the immediate future?
It's not possibly being closed. They are being closed. We did a rapid survey in the Western Cape of 150 ECD centres, and we found that half of those, 50%, have closed and probably will not open. And then the other 50% of those who have taken children back, they're only operating at about 20% capacity. That means that close to 2 million children are not getting the early learning opportunities that they want. But it gets worse, because we've heard of horrific stories in the provinces where the Department of Social Development is withholding subsidies for nutrition and the country's most vulnerable citizens, its young children, are suffering. We have taken this to court. It's going to court next week, but the minister has not even given us the courtesy of responding to why are they cutting subsidies, why are they removing subsidies, and why are they taking food out of young children's mouths.
And I want to talk a bit about that, Prof. I mean, what is it that you're requiring at the moment? The Centre for Early Childhood Development has previously urged a government to provide a once-off allocation COVID-19 pandemic-related grant of about 20,000 Rand, if I'm not mistaken, to each registered early childhood development centre. That too has fallen on deaf ears. Is that still the request at this point of 20,000 Rand per registered facility?
It wasn't only for registered facilities, it was for unregistered facilities as well. And the reason being that the most vulnerable centres are those that are unregistered. Now, they do not want to remain unregistered. They want to register, but the cost of registration is so high that it's unaffordable. And you know what the inequality is like in this country and what the poverty is like. These centres, and there are about 16,000 across the country, they will never be registered because it's simply too costly. But what the strategy the department has adopted is, let's rather shut those, let's get them or remove them from existence, and in that way, they're not living up to the various charters and conventions and to the country's constitution, which says put young children first. I do not believe that the department is acting in best interest of young children, as is their mandate.
There is another issue of the right for children to get an education. And of course, what happens to those children whose parents perhaps decide they're not comfortable with sending their children to these centres as yet, and would prefer the home method?
Yes, there is. Parents have the right to keep their children at home. We follow the medical evidence, the evidence of experts and of the World Health Organization, that children are relatively safe and relatively immune to coronavirus. But we leave that to the medical fraternity. But they've told us worldwide that young children can go back to the early learning environment. The Minister of Education has said even for children in primary school, if parents are not comfortable, they can keep their children at home. And there are wonderful programs across the country that work directly with parents, providing materials and providing guidance. So those children should not be disadvantaged either.
And how different, is the ECD programming going to look going forward in light of COVID-19? Surely, this is all going to be new for these little learners as well as the teachers themselves. So obviously a different picture is what we will see going forward.
Yes, well, we're certainly going to see a different picture going forward. The tragic part of the picture going forward is that probably half of those ECD centres will not open again. And again, that leaves 1.2, 1.3 million children without a service. Many non-profits across the country, including the Centre for Early Childhood Development, we are coaching and supporting ECD teachers to open, and we are giving them opportunities and materials to work within the pandemic. We're certainly going to have to work within the pandemic and its requirements or regulations for the next 6 months. So there are wonderful efforts from many non-profits around the country to support centres in opening. And I want to repeat that centres have been allowed to open from the 6th of July by order of the Gauteng High Court.
Prof, thank you very much indeed for joining us this evening. And we certainly look forward to what will happen over the next coming weeks. The Director for the Centre for Early Childhood Development, Professor Eric Atmore. Just to also inform you that we did invite the Minister of Social Development, Lindiwe Zulu. She was not available, nor was another representative from her department.